The New York University and CUNY Prevention Research Center is Centers for Disease Control funded, and our goal is to help advance research on prevention of heart disease.
The research that we do at the Prevention Research Center is very action-oriented. It's based on a framework called community-based participatory research, which means that community members, community organizations are active partners with us in terms of developing the strategies, helping us to collect the data, and they help us in terms of evaluating the findings. Working with our community partners in that way helps also to think about how do we inform what we do, how do we take the findings from our research to inform policy. The CDC program happens to be the largest and oldest extramural program that's focused on applied public health, population health, community health.
The federal government here in the United States started a campaign to try to reduce heart disease and reduce disparities in cardiovascular health. The U.S. Million Hearts campaign has a target of trying to reduce the number of heart disease deaths by 1 million by the year 2017.
The PRC program allows us to develop targeted community-level interventions that apply a very strong public health component to it.
We have a particular interest in working with immigrant populations, in part because they're often disenfranchised from care for cultural reasons, for language barriers. So what we're trying to do is infuse all of our work with a very fundamental cultural competency involving community partners in designing the interventions so that what works in the clinic is appropriate for the community. What works in the community is translatable to the clinic and reaches up to the larger health systems, partners like payers and health insurance companies, and can be sustained and reimbursed. We have a number of research projects. One project in East Harlem where we're working with a lot of partners to put community health workers in public housing residence and work at the building level. We have another research project that's focused on a cluster of practices that are serving South Asian residents in Queens. And we're working with them to say, how can we reach into the community and involve community members in interventions across different clinics, all funded and supported by a health insurance company.
Our core research project for the NYU-CUNY PRC is Project Impact. Project Impact is really an integrative model of working on both provider-level interventions with community health worker interventions and actually directly integrating community health workers into provider practices. We know that the South Asian community has disproportionately high rates of hypertension and diabetes, and so thinking of culturally meaningful ways to promote hypertension and diabetes management in this population while also thinking about innovative models to really integrate community health workers into the healthcare system.
The last 5+ years has been really focused on Asian American populations, in particular the Korean communities, the South Asian communities. We've also done some work in African American population, Caribbean populations with respect to cardiovascular disease and diabetes prevention using a community health worker model.
Community health workers are really lay community leaders who are very closely connected to their community, have a very close understanding of community norms, of language, of what's going on in local contexts. Community health workers really serve as a bridge between communities and healthcare systems specifically, but also just communities and systems more generally.
I think community health worker role is very important because the doctors don't have enough time, maybe 10 to 15 minutes they can see most of the patient. They just advise them to exercise, eat healthy, and take this prescription. But we as a community health worker, we tell them what food you can eat from our culture. We teach them what kind of exercise they can do, and also one-on-one visit gives us the opportunity that we can do exercise not only with this person, we can also include his family so that the whole family can exercise with us.
Our community health workers really help the members that they work with think about, how to integrate health promotion and disease management into the daily context of their everyday lives. Physicians and nurses could really benefit from the support provided by community health workers to work directly with community members to engage in health promotion and behavior change activities that are meaningful to community members.